Decision will depend on what public health officials have to say. Dr. Wesley Willeford with the Jefferson County Department of Public Health joins us now live to talk about some of what we're seeing. And let me ask you, Dr. Willeford, just from the standpoint of public health, do you think this April 30th stay-at-home deadline will hold, or will we go beyond that?
So right now, as we're continuing to see that we're having fewer cases each day, especially here in Jefferson County, and I'm hoping we continue to see that occurring. But as far as that date, I think we're going to have to be flexible on it. I think we're going to have to continue to monitor the case totals each day. Ideally, what we want to see is no new cases, no deaths, and people really getting better from that. And I don't know necessarily if we'll be there by April 30th.
As we look at a lot of national news, can you talk about when we expect to see that sort of peak here in Jefferson County? Still some days out.
Sure. The prediction right now is that that's going to be around April 20th, April 22nd, somewhere in that area is when we get to peak resource use. So the highest number of hospital beds, the highest number of ventilators, the highest number of people sick, and most likely the highest number of deaths per day. Once we get sufficiently beyond that, I think we'll know a lot better where we stand in the grand scheme of things.
The governor talked today about the disparity among deaths, particularly African Americans in the state dying more often than other people from COVID-19. Can you address that?
Yeah, and that's something that, as Dr. Harris was talking about today at the press conference, something that certainly is affecting people disproportionately in our county and at the state. And I guess the question is why is that necessarily? And that may be that we're seeing other illnesses that are sort of concentrated in places that are making people more vulnerable. And I think that's speaks to some issues with our healthcare inequalities that exist in our system.
And to the extent that people want to be able to protect themselves, people want to know specific zip codes where this is happening. We get some broad information, but for individuals who want to try to protect themselves in their community, is there resistance to giving out zip code information specifically in Jefferson County for where the cases are happening?
That's a great question. You know, one of the things about the zip code data is that the reason that that data is often held back is you want to have enough cases in a particular zip code so it's not to be like giving away a person's location who might have it. So, for instance, if one person in a community in a zip code has COVID-19, and a neighbor knows about, well, that must be my neighbor who had it. And so it can jeopardize privacy. And so that's why before giving out that zip code data, we want to make sure there are enough cases so as not to jeopardize any one person's privacy.
So people who want that information right now can probably rest better knowing that that may mean that there are fewer cases in that community. But to the flip side, at what number would you begin releasing that type of information?
And that's something that we talk about a lot here. It's those numbers are sometimes hard to pin down because it will vary by disease and vary by the stigma associated with the disease. And that's something that we're still in active conversations with here is at what point do we release that data and how low do the numbers have to be, how high they have to be. And that's something, again, we're still discussing here at the Health Department.
Dr. Wesley Willeford, UAB at the Jefferson County Department of Public Health and Infectious Disease, thank you for talking with us.
Thank you.
You can stay up to date right now with this coronavirus emergency, getting all the information you need to know to keep yourself and your family safe right now by going to CBS 40.